I get a boatload of questions about knees, and oddly enough, I'm fascinated with knees. I spent my career as a soccer player protecting my own knees, and because knee injuries are so common, I've dedicated my career as a doc to learning everything I can about them, and specifically how to heal from knee injuries, as well as how to prevent knee injuries. I'm Dr. Lizie, and here I'd like to go over knee ligament injuries and offer you general info about them and how they occur, and more importantly, how to prevent them, or in the very least, help you determine if you are at risk for a knee injury and reduce your risk of knee injury. Essentially, within your knee, you have 4 major ligaments, 2 cruciate ligaments that are within your knee joint capsules, and 2 collateral ligaments that are on the outside of your knees. So causes of knee injuries, well, knee injuries are not always the result of a major impact, such as traumatic impacts during sports or auto accidents. The ligaments in your knees, or even the meniscus, could easily become injured during everyday activities, such as stepping off of the curb. There's a reason why. Your knees may already be at risk for injury. The main causes of knee injuries is because of these 3 key factors that put you at great risk for knee injury. If you have poor quality ligament fibers, this is mainly due to inadequate nutrition, where ligament fibers are simply not strong enough to withstand even the slightest amount of force, even that of your own body weight. Number 2, if you have a misalignment of the bones that make up your knee joint, the femur, tibia, and fibula, or if you have any type of muscle imbalance or postural imbalance where your knee joint is simply not tracking properly. Third key factor is if there is a miscommunication in your nervous system that causes faulty balance or proprioception. It leads you to have poor biomechanics and move in unordinary ways that your body is not meant to move. So let's discuss the 2 cruciate ligaments first. As a side note, cruciate means cross-shaped, as is the case with the 2 ligaments within your knee joint. They form a cross, overlapping each other, and attached from the femur to the tibia. A very easy way to remember the names of your ligaments is based on their location within your knee. Your ACL is more towards the front, while your PCL is more towards the back. But to dive deeper into how they work and the purpose of your knee ligaments, we can look at what they are doing for you and your knees. The easiest way to remember their function is based on the movement of your tibia, the main lower leg bone, because they are named after the motion of the tibia they are preventing. So we use your tibia as a reference point and how the ligaments prevent excessive motion of your tibia as it relates to your femur. Your ACL is more towards the front of your knee and it prevents the tibia from moving too far forward, while your PCL is more towards the back and it prevents the tibia from moving too far backwards. Your ACL could be injured through things like sports, where you get a direct tackle. It could be injured through you planting your foot and then twisting, or rapidly changing direction. Like if you're running, for example, and then twisting your body really fast. Another way you could get an ACL injury would be if you had a big muscle imbalance between your quadriceps and your hamstrings. Your quads are on the front of your thigh. They help to extend your knee straight. Your hamstrings are on the back of your thigh, and they help to bend your knee. Many people with a big muscle imbalance between their quadriceps and hamstrings are causing imbalances and changes in their biomechanics. And this isn't good, because if your quadriceps are too strong, they could really send your knee out into a hyperextension type of motion while you're running, and that could potentially lead to an injury over time. So if you have those types of muscle imbalances, you want to correct the muscle imbalance between your quadriceps and your hamstrings. And finally, if you have something called genu rectivatum, or hyperextension of the knees, where your knees are hyperextended in every activity, including standing, that repeat stress will be on your ACL ligaments, and that could lead to an ACL injury over time, because when your knees are really hyperextended, you're stressing your ACL. So there are 4 examples of how your ACL can be injured. So let's discuss the PCL. PCL stands for posterior cruciate ligament. Now the PCL injuries are much less common than ACL injuries, particularly because they go unrecognized, but more because your PCL is stronger, with 2,000 times the tensile strength of your ACL. Although it is larger and stronger than the ACL, the PCL can be torn. PCL tears make up less than 20% of injuries to knee ligaments. Injuries that tear the PCL often damage some other ligaments or cartilage in the knee as well. Again, the main function of your PCL is preventing your tibia from traveling too far backwards under your femur. If that's the primary function of the PCL, then the main way this ligament becomes injured is through traumatic incidences where the tibia is forcefully pushed too far backwards. PCL injuries are often due to a blow to the knee while it's bent. Common causes include falling on your knee while it's bent, or striking the knee against the dashboard during an auto accident, for example. When your knees collide with the dashboard, the tibia is forced backwards really fast with the impact. Because the PCL is one of the strongest ligaments in your knees, it takes a traumatic incident or impact to injure it. If you plant your foot and quickly change directions, as football and soccer athletes do during games, that is another way your PCL could be injured. Now let's talk about the 2 collateral ligaments, your MCL and LCL. and they are on the middle and outside portions of your knee respectively. Let's talk about the one injured more commonly, which is the MCL, or your medial collateral ligament on the inner part of your knee. Your MCL prevents your knee from going inward. This ligament can also be injured in a traumatic incident like football tackle. Say someone tackles you and collides with the outer portion of your knee or thigh, and your knee is forcefully pushed inward. That can cause an MCL injury. Another example is if you have a malpositioning with a genu valgum, where your knees are constantly in a knee-knocked position. This could lead to constant ligament strain and over time cause injury. If you have a muscle imbalance where your gluteus maximus muscle is too weak, this can cause internal rotation of your femur. See, your gluteus maximus is the main hip external rotator, and because your gluteus maximus externally rotates your hip, when it's weak, your knees will always be turned inward, and this can lead to your MCL being under constant stress and lead to an MCL becoming injured over time due to overuse. Now let's look at your LCL, which is not injured as frequently as the MCL. Your LCL is on the lateral portion of your knee, known as the lateral collateral ligament. Your LCL prevents your knee from going inward. Your LCL could be injured once again through a traumatic incident. In this case, the LCL would be under the most stress with a football tackle to the inner portion of your knee, where your knee is forcefully pushed outward. Also, with an athletic move or a sharp change of direction after planting your foot and rotating or moving across your body, this would strain the outside of your knee. The LCL can be injured or at risk if you have a malpositioning known as a genu varum, where your knees are constantly in a bow-legged position. If you're bow-legged, there is a greater amount of stress on your LCL. So there's your intro to knee injuries and possible causes of injuries to your ACL, PCL, MCL, and LCL. We barely skimmed the surface of how knee ligament injuries happen, but I love knees and I want to help you protect yours. If you currently have a knee injury or have had a knee injury in the past, let us know and we can help you heal your knee injury and get you back in the game. If you're struggling to recover from a knee injury before or after surgery, we can help you. If you play sports and want to prevent knee injuries, definitely call us and set up a visit. We can perform simple tests to determine if you're at risk and help you set a strong foundation to prevent any knee injuries to your ACL, PCL, MCL, or LCL. Anyway, if you like this video, thumb it up and post a comment. Subscribe to my channel. I'll create another fun video showing you general knee stretches and exercises to help you stabilize your knees. Until next time, be epic.